What makes a child healthy and well?
So it's not merely the absence of disease, but social, physical, spiritual, emotional well-being. And that's our definition of health.
A person's living conditions, environment, and the resources available play a pivotal role in the health of a population.
So much more to the health of a child and the development of that child's brain. We need to drastically change our view of what healthcare is.
Mississippi ranks 50th in child well-being. What are the challenges that parents face that are preventing children from growing up well?
Southern Remedy is underwritten by a grant from the University of Mississippi Medical Center and viewers like you. Thank you.
My name's Leslie Junkin. I have one daughter, Isabella.
Good old boy.
I know, that's when you were born.
You cheer.
We live here next door to my mother in Columbus. Isabella is 17, and she is probably one of the most interesting people I know. She has tons of personality. She likes to cook, and she never forgets anything. We've often said if we could figure out how to get her as interested in education as she is in what's on TV and how to design her clothes and what ingredients go in a recipe, then we wouldn't have any of the educational struggles that we do.
You've already told me, she said I was an old lady.
She really enjoys her people, as she calls them. And if you're one of her special people, then you're in a really good place. I had a normal pregnancy and normal delivery, no indication of a problem. When she was 3 months old, our pediatrician said, you know, I'd like to run these tests. She's not meeting some of the developmental markers that she should, and we just want to rule out the possibility of Down syndrome. People have said, you know, how did you cope with it? I said, well, it was always for me an issue of, I can't fix this. I came home, I started calling other pediatricians and said, here's what's happened. They had us set up with early intervention, and we started therapy within 2 weeks.
When we think about health and health outcomes, most of the time people think about health care. And yet when you look at the data, health care only affects about 20% of the outcomes that we see. You have genetics, which is about 10%, health behaviors, that's about 40%, environment, that's about 30%. Health care is critically important, but it's only one of the determinants of health and health outcomes that we need to think about. So the social determinants of health underlie all of those issues.
Access to health care, education, income, culture, and where you live are some of the social determinants of health. They contribute about 80% toward an individual's health and well-being. One condition that is highly associated with poor health and has the most dramatic effect on the young is poverty.
Mississippi's poverty rate is higher than most other states in the country. You can't have a conversation in terms of what the connection between poverty and children's health without talking about the social determinants of health.
Leslie Junkin works 2 jobs and has private health insurance. She says she's fortunate to have income and health insurance because Isabella's intellectual disability is associated with chronic diseases. The first of these chronic diseases was diagnosed when she was 6 years old.
It was February of her first grade year. The teacher called and said, she's acting a little strange today. So we went and picked her up and went to the doctor, and her blood sugar was over 700 that day.
Type 1 diabetes is most prevalent in children under the age of 20. Nearly 167,000 patients with type 1 diabetes have been reported in the U.S. The Diabetes Foundation in Mississippi says that at least 1,800 children in Mississippi live either with type 1 or type 2 diabetes, and the numbers are growing.
In the space of 30 minutes, I went from parenting a child with Down syndrome, which was okay, to giving my child insulin injections. At that point, Down syndrome became secondary. That's who she is. We don't really even think about that anymore, because if we can't manage the health issues, then it doesn't matter what the developmental problems, seem to be.
Isabella has been diagnosed with a series of autoimmune diseases, including juvenile diabetes, polyglandular autoimmune syndrome, and celiac disease. Celiac disease and diabetes both require a special diet.
Grocery expenses on a good month we spend about $600. And that's just to keep her food in the refrigerator that's fresh food, that's not processed foods. You know, there are some options that are out there that are not quite as expensive, but again, it's not fresh foods. It's not the healthier foods that would be a better choice for her when it comes to providing a diet that is not only going to help her health, but just help her overall.
On this day, Leslie drives 300 miles round trip from Columbus to Jackson so Isabella can see a specialist for an eye infection.
We're in Flowood, so we can go and see Dr. Palmer today about
For
your
Leslie,
eye.
getting Isabella to the doctor is more complicated than just the
A
drive.
rash on your chest. Okay, we'll let her look at that too. Transportation, it's always a concern. You know, do you have the money for the gas to get there? Do you have the money to buy lunch? If it's going to be a trip that puts you in the middle of the day, because she is diabetic, you always have to pack, you know, do you have stuff you can take with you to make sure she doesn't get low? Let them try so that they can see how the lotion makes your skin look better. Well, it'll be okay if you're mad. You'll be happy when you get there and see all your friends and all the ladies that you know at Dr. Palmer's office. Just say in the last year, we went to Jackson 8 times for doctor's visits. Okay, that's 3,000 miles on a car. That's 8 tanks of gas. That's 8 meals at a minimum, not counting I missed a day of work every time that we went. And plus she misses a day of school.
Traveling far distances to see doctors is considered normal for many of Mississippi's rural residents. The state has one of the nation's worst doctor shortages. Access to doctors and the healthcare system determines whether sick people get better and how well chronic diseases are managed.
We have to check in with Granny and tell her that we made it to the doctor, okay? I just have to send her a text and tell her we made it to Jackson so that she doesn't worry about us. Now she knows that we made it, and then we'll let her know when we get ready to leave that we're finished. Do you want me to sit by you? Yeah. Yes? Okay, I can come and sit by you. Come here, it's okay. Shh. It's all right. Don't cry. Oh, goodness, this ponytail is just everywhere. Don't cry. It's okay. It'll be all right. It'll make your eye feel bad if you cry. I know. You want to blow your nose for me?
No.
You don't want to blow your nose for me?
Mm-mm.
About 400,000 Mississippians do not have health insurance. Between 50 and 60,000 of them are children. Many children without insurance actually qualify for Medicaid or the Children's Health Insurance Program, CHIP, but are not signed up. For a family of 4, the income cap for CHIP is $4,233 per month. Income eligibility for Medicaid insurance varies depending on the age of the child.
Through my job, I have Blue Cross Blue Shield of Mississippi, and then Isabella is also on that policy. I think it's around $600 a month for her. And then she also receives benefits through a Mississippi Medicaid program called Disabled Child Living at Home, and that's based on her disabilities and not my income. She doesn't receive any other benefits other than the Medicaid, so my Blue Cross has to be primary and that is secondary. If you take into consideration the special diets, alcohol swabs, lancets, and Band-Aids, and all the other necessities that come with that, we end up spending about $15,000 a year out of pocket. Yes, thank goodness we have insurance, but it's not free. I'm still paying a $600 a month premium to keep her on my Blue Cross. And then you still have all of the out-of-pocket expenses. You know, you need a part-time job making more than minimum wage just to cover our out-of-pocket expenses. And that's with me working 2 jobs and doing part-time work whenever I can find it, just to try and survive.
Isabella's father died when she was an infant, making Leslie the sole provider for her care. Leslie says she is fortunate to be able to provide what Isabella needs. But with 34% of the state's children living in poverty, many parents struggle to do this.
Good morning and welcome to Southern Remedy Kids and Teens. I'm Dr. Jimmy, and I have a special guest with me this morning, Dr. Bernard Dreyer, who's the current president of the American Academy of Pediatrics. And We're going to have a special discussion about something that affects the lives of pretty much all Mississippians, but particularly the lives of our children of our state, and that's poverty and how it impacts health. How big is the problem of poverty and how does it affect our children?
Children are the poorest group in our society. So about 20% of children are living below the federal poverty level, which actually doesn't adequately measure poverty. Probably about 200% of the federal poverty level is where families actually have enough funds to meet those basic needs. That would be almost 1 in 2 children. So we know by the time poor kids get to school, they're not really, many of them, not all of them, but many of them are not ready to begin to learn. And so one of our areas of focus is to improve services in early childhood to poor families, because we think we can really make a difference there.
But there's a lot of areas there that really we're not supporting families before they actually have that.
Absolutely. We talk about crossing the birth line and being on both sides of that, so that absolutely, really this starts prenatally.
With child poverty at 34% in Mississippi, some community organizations run home visit programs. They promote the health of the mother and baby during pregnancy and after the baby is born. One such organization is the Delta Health Alliance in Indianola.
We're visiting with families in their homes to help them to be better parents, and we're monitoring children's development to identify any kind of problems that they might have early. Our goal is to try to help women have safe, healthy pregnancies to reduce the infant mortality rate and improve low birth weight rates in our area. So we enroll the mom when she's pregnant, and we make sure that she's getting her prenatal care and she's going to the doctor's appointments, dealing with any type of chronic health condition she might have, and helping out with all those types of things that she would need to have a healthy pregnancy. And then once the baby's born, we continue to follow the family and we'll be with them until the child turns 2.
We know home visiting makes a difference. We know high-quality childcare makes a difference for that child's brain. We know pre-kindergarten programs that are functional make a real difference for both generations, because they often focus on both, and Head Start makes a difference.
But it's not just about the academic side of it. It's more of it's the social, the emotional needs of that child, and those are incredibly important for development.
If we had to choose, we'd focus first on the social emotional needs. But the important thing to recognize about child development is you can't separate those things.
Right.
Pre-K education is critically important. There's been a lot of data out of the Harvard Child Health Center that shows early childhood education is a definite precursor for outcomes later on in life.
Mississippi does not have universal pre-K. However, in 2013, the Mississippi legislature created the Early Learning Collaborative Act. This provided $3 million in state funds to help support, establish, and expand 11 pre-K programs across the state.
We're trying to use the private sector as an asset rather than a liability to the private sector through the learning collaboratives or pre-K collaboratives. And I would love for us to expand that at a rapid pace, but all new ideas are limited by funding.
Through these state-funded collaborations, only 4% of Mississippi's 41,000 4-year-olds were enrolled. State lawmakers added $1 million to the program in 2016, which now funds 14 early learning collaborative programs.
Investing in early childhood has been shown by anyone who looks at it that that's what you need to do to achieve positive outcomes for children, to overcome any kind of economic, educational, health inequity.
We would love to go into full-blown statewide collaboratives. I have no intention of ever doing public-funded pre-kindergarten. I mean, the system can't stand that huge of a shock, and the local school districts can't do it. We'll focus on the areas that really need the assistance, and that's where we will send the resources.
And those early formative years between 0 and 5 are critically important, not only neurologically, but educationally.
There are 11 early Head Start child care centers in Mississippi that cater to children up to age 3. They are designed to build a foundation for education, nutrition, and health for children. Erica Lessner benefits from the child care.
I have a son named Taylor Lessner, and I am divorced from his father, so therefore it makes me a single mother. I work at Winn-Dixie here in Biloxi. My oldest child did not attend preschool or any child care, and my youngest obviously does, and I can see a difference in the learning and how advanced the little one is compared to the older one.
Good boy. Be a good boy. Go poop in the patio.
There was a lot of information learned about the brain development in infants, the importance of beginning to build the foundations of cognitive development very early on, starting with birth. An early Head Start creates a program that is extremely comprehensive. You're able to work with the child in the classroom that supports the child's cognitive development, physical development, emotional development. So the program has a comprehensive design that makes sure the child and the family have their health addressed.
Had I not brought my children to more community house, I wouldn't have known anything about a speech therapist or taking my son to the eye doctor, or, of course I know to go to the doctor, but like the dentist and stuff, I wouldn't have known to do all of that. My husband and I have 2 children, Genesis and DJ. Genesis attends Moore Community House, and DJ is in the 1st grade. She loves to go to school. That's all she talks about when she gets home.
One foundation for good health is proper nutrition with healthy foods. What children eat is directly related to their physical health now and in the future.
I did not know until we got into this program what the proportion size for each category on the plate was supposed to be. She have breakfast here, lunch here, and snack. And if she goes to aftercare, she'll have an afternoon snack. Because I have to be at work so early, so having the food program at the school helps a lot.
Isabella, she is a student in the Lowndes County School District. She attended school up until her diabetes was diagnosed. Once the diabetes was diagnosed, we opted to receive homebound services from the public school system, which is she has a significant enough medical diagnosis that it's safest for her to be in the home just because of germ exposure.
Oh, juice. 185. That's great.
Yes.
That's good.
They provide a teacher for us that comes 3 hours a week and provides one-on-one instruction with her, as well as a speech therapist who comes once a week for an hour. And they have been with us now, it's been 8 years. This is the 8th year, and she will actually graduate in May of 2017. Education has been a challenge because she hasn't had the opportunities to experience the social things that her peers have. But we've worked really hard to make sure she had social opportunities.
Oh, you're right. Yeah. Okay.
Ooh, you like that turkey? Okay. Let's see.
Right now, Isabella's educational level, if you tested, her reading is still probably kindergarten level. Math skills are probably about the same. Academically, because of the intellectual disability, there's some significant delays. But to have a conversation with her and watch her function in her home, you wouldn't necessarily notice those academic struggles, as openly as you would if you saw her in a group of teenagers.
2.
It's the end of a long journey in dealing with public education. Public education for children with intellectual disabilities can be challenging. We've been fortunate to be in a good school district where we have had good support and good services that have been available to us. There aren't a lot of community programs available for her to participate in as a young adult. So once school is over and those teachers stop coming, that's a big piece of her life that's not going to be the same anymore.
I'll see you in breakfast. Okay. All right. Bye.
According to the Economic Policy Institute, Families in rural Mississippi with one adult and 2 children needed an income of $51,180 a year to meet basic needs, but the median income for a woman in Mississippi is $31,465.
And women typically get in service jobs, jobs that pay $7.25 an hour and have very little flexibility, very few benefits.
Do you think that because of the way family dynamics have changed over the years and last?
In 2015, Kids Count reported 48% of Mississippi children live in a family headed by a single mother, and 64% of the families in poverty in Mississippi are headed by single moms.
There's been a general increase in single parenthood. That's certainly, one parent is, especially if they're poor, is just going to be much more stressed out. I mean, I speak to mothers who are single parents who are really doing their best, but you know, they're working 2 jobs just to keep in poverty, not to get out of poverty.
Another very important phenomenon that we now see that impacts a child's health and long-term well-being and economic and educational outcomes is something that we call toxic stress. And we know that children who live in poverty are exposed to a large amount of stress just because of these social determinants.
Think about working 2 jobs, having a child, and then coming home, figuring out what to do about childcare, where to leave your child when you're working, worrying about that child all the time, and then realize how stressed out that mother is, or father.
Women in Mississippi make up about half of the workforce and hold 2/3 of the minimum wage jobs. Compared to men in the state, women earn 77 cents for every dollar a man earns. Advocates say closing this income gap can help working moms.
It's hard. It's really, really hard because I have no idea what tomorrow brings. I don't know if 6 months from now I'll have a job. I don't know if 6 months from now she'll be sick. I don't know if 6 months from now something else may go wrong. You know, there is no way of knowing. Tell Dr. Palmer hello. She wants to give you a hug. You're done? Okay, you gonna get back up there and let Dr. Palmer look at you?
And you got your flu shot? Yeah.
She's never had one.
Hush.
No.
Girl.
I'm just terrified of the flu shots.
Well, me.
I know. Dr. Lily tells me.
She needs to make that jump.
I know.
First year's the worst year. After that, it gets easier.
And I have so many friends who say, well, I'm embarrassed to go and try and get food stamps, but I can't afford to feed my kids. You know, I had that conversation with a family member last weekend. She said, I went and applied for food stamps, but they said I make $50 a month too much. She's got 4 kids at home. She's trying to see what's in there. It's a rabbit. There might be a rabbit or a squirrel in there. And in the shame that comes with that, and you are made to feel ashamed. I do good. You know, I go to work every day, and I take care of my child. I take care of what we have to have. Are there days that we need support? Sure. Are there days that we need help? Yes, every day. But it doesn't mean I don't try. In your purse.
So if it is at pink eye, which is a viral infection, it's contagious. So we won't want to touch. She will wear eye makeup. It could go from one eye to the other, and so that's what it looks like right now. Okay.
It's easy when you're making $100,000 a year to look across the yard and say, oh, she's making 35. Why can't she make ends meet? Well, it's because I'm making 35. Could I choose a different job? I don't know. Is there one out there that'll pay me that? If I give up the ability to take care of my child, be here if she's sick, take care of her if she needs to go to the hospital? Did you tell Dr. Palmer you're going to graduate in May?
Great.
All right.
She said she was tired of school, so she wants to graduate.
That's exciting.
I know, I'm excited too. Sometimes the choices you're forced to make to take care of a child that's critically ill or chronically ill puts you in a position to not always look as pretty as the neighbors do. Come, okay?
Okay, I'm gonna definitely come and get your numbers, okay?
Tell her thanks so much.
Hi, Isabella.
You
See
tell
you
her bye.
later, okay?
You want a hug? You had to tell her.
You may be graduated by the time I see you next time. Yeah. Just 6 month appointment.
Be close to it.
That's the part, okay? Bye. Yeah.
Tell Dr. Palmer thank you.
Okay. I'll see you there. Bye.
Poverty impacts everything.
We have low-income individuals of all races, and their lack of access to quality services, quality resources exist regardless of race and ethnicity.
Well, we have to realize that health for a child means so much more than being physically healthy. There's something we call social determinants of health that are so important. In fact, research has shown that those social determinants of health are much more important to that child's long-term well-being than just that child's physical health growing up.
But if we can grow strong groups of children into functioning, economically viable adults, we can get rid of many of these problems.
So all of these are family issues that we must address at higher levels. One-on-one with my families, I just try to refer them to resources that are available in their communities. But again, those resources are limited, and that's where policymakers come in to play. Everyday citizens, the faith-based communities, we all have a lot to give, and we just need to come together.